Hello, everyone. Thank you for joining us today. My name is Eric from All American Medical Group, and I will be your host today. This is the CCHCA Grant Program live stream for SteppingStone's presentation entitled Enhancing Care to Isolated, Frail, and Low-Income Chinese Elders During the COVID Pandemic. So CCHCA's annual community grants program provides funding to projects benefiting the public health of Asian American communities in the San Francisco Bay Area. And this seminar will highlight the content of the program. After the presentation, we will have a 15-minute Q&A session. If you have questions, please leave them in the chat box, either on Zoom or if you're watching on YouTube, leave it in the chat box there. With that said, let's get started. Welcome, Daniel Gallagher and SteppingStone for joining us today. You may take it away.
Thank you, Eric. Hello, everyone. My name is Dan Gallagher. I'm the Executive Director of SteppingStone Adult Day Healthcare. And as Eric said, our presentation today revolves around SteppingStone's response to the COVID-19 pandemic and the enhanced care we provided our participants, in particular, the Asian Pacific Islander community. Just a little bit about SteppingStone before we look at this first slide. SteppingStone has been in existence since 1983. We operate 4 centers in San Francisco, 2 north of Market and 2 south of Market that belies our legal operating name, North and South of Market Adult Day Healthcare, doing business as SteppingStone. We are the oldest and largest provider of adult day healthcare in San Francisco, and we serve close to 300 frail elders and adults with disabilities daily in these centers. They're located at 350 Golden Gate Avenue in the Tenderloin and 301 Ellis Street in the Tenderloin. And then south of Market, our Mabini Center is located at 55 Mabini Street, and our Mission Creek Center is located at 930 4th Street. 95% of our program participants are older adults and adults with disabilities with the average age of about 75 years old. 80% are Asian Pacific Islanders. All of our participants are disabled, and many have forms of dementia, depression, or other mental health conditions. And many of our participants live alone in small residences, and so being confined to their homes for months posed a real danger for them and their health as they risked the COVID virus. Most of our participants speak a primary language other than English, and most did not have any online access at the beginning of the pandemic. We really felt the need to engage our participants as quickly as possible because of the shelter-in-place order. So let's go to the next slide, Eric. So in March 2020, when the shelter-in-place was enacted in San Francisco, SteppingStone had began the calendar year of 2020 with really strong operations, really expert staff, years of experience serving the frail elders and adults with disabilities that we serve. But we would really need all of our strength to respond to what was happening in San Francisco in March of 2020. At that time, we were probably serving in center well over 200 participants a day. And when the pandemic started to seep into San Francisco in early March, we saw a pretty dramatic decline of people wanting to come in because of the fear and the realistic fear of COVID. And we knew then that we needed to do something immediately to start reaching out to people who couldn't come into the center And then when the stay-at-home order happened, as of that was, I think, March 17, we knew that we had to shift our programming to reach out to everybody. So within days of the shelter-in-place order, we met the challenge by opening up a call center. So I think our last day of providing InCenter Services was March 20. It was a Friday. And on Monday, we opened up a call center at one of our centers so we could reach out to every participant we had with a small clinical team of people, an RN, a social worker, a program director, and one of our administrators, just to make sure that we could connect with everybody and see what their needs were at that time. And they were voluminous. People were scared. They were in need of different kinds of services, and they were confined to their homes. So by the second week, we had assembled teams of nurses, social workers, and other clinicians operating out of each center. So we as a center had to suspend all of our in-center services and shift to a different model, and shifted to a telehealth model, which we end up calling Centers Without Walls. And so these teams of nurses, social workers, and other clinicians, again, operating out of each of the centers, called their clients and provided assistance. And we did it center to center because the clinicians that we had at each center knew their clients well, knew their families well, and we wanted to make sure that they could trust what we are trying to provide in support of them at this point. So we provide service calls in the primary language of the participants, and that would be either Cantonese, Mandarin, Korean, Tagalog, Spanish, Vietnamese. We have some Russian speakers, and SteppingStone has those language capacities. One of the challenges at this time was our services weren't funded because reimbursement from Medi-Cal, which funds us through the participant eligibility for Medi-Cal, depended on attendance at our centers. So we were operating on reserves and emergency funding from generous private donors and foundations before we were able to do quite a bit of advocacy with other adult day healthcare centers in California, and to get a waiver from the centers for Medicaid and Medi-Cal, so we could start getting funding. But that didn't happen for a good 6 weeks after we started our Centers Without Walls model. And the model was providing wellness calls, COVID-19 screening, care coordination, referrals, a lot of patient advocacy, and we immediately saw the need to make deliveries of food, medicines, masks, and other essential supplies to clients because they were sheltering in place in their homes. Many of them were isolated. Next slide, please, Eric. And this is a picture that depicts how our clients felt. They didn't want to live in isolation. They want to make sure that we could engage them and they could engage us. And quite frankly, they want to engage one another. What we've always liked to say at SteppingStone is our participants come for the healthcare, but they stay for the community. And we all know that loneliness and isolation is a huge health risk for older adults in San Francisco. And so keeping that in mind, we knew that we had to shift our model to make sure that we could engage our clients and they couldn't engage not only us, but their friends that they met at the centers as well. Next slide, please. So once we were able to work out some of the kinks that we had with the Centers Without Walls models, then we want to build upon the telehealth model of finally what was approved by the Department of Healthcare Services and the Centers for Medicaid and Medi-Cal, after vigorous advocacy, was called Temporary Alternative Services. And we are still providing temporary alternative services as we speak. We were able to expand participant engagement with enhanced doorstep visits to include personal assessments with our physical therapists, as well as delivering food, medicines, and supplies. But we wanted to make sure that we had personal engagement with our participants and we can see them and provide in-person assessments with them. So we're able to do that with our doorstep visits. We offered garden exercises at our center's outdoor gardens. So this was a time when people could come into our centers, but only in the garden area and not in the actual center. But it was outside, and we offered physical exercise activities where participants could safely distance from one another. And then we began virtual programming via Zoom and Skype to provide physical therapy, exercise classes, support, socialization groups that I mentioned earlier, which is so important to our participants, and one-to-one assessment in healthcare. And really, our goal here was just to keep everybody as engaged as possible so they could maintain their health and they can continue to live at home and stay involved in the communities and stay connected with us, and we could stay connected with them. And this was one of the great challenges that we had to provide virtual programming, because not everybody had internet connection or had a device. And if they had an internet connection and they had a device, they needed a lot of education, a lot of technical support around that. And I'll talk a little bit more about that a little later. Okay, Eric, next slide, please. So this is a video that will just illustrate our doorstep deliveries and some of the virtual programming that I mentioned. So it's probably about a few minutes long, but it's a good video. You'll like it.
So no one told you life was gonna be this way. Your time's a joke, you broke, your love life's the way. It's like you're always stuck in second gear. But when it hasn't been your day, your week, your month, or even your year, well, I'll be there for you. When the rain starts to pour, I'll be there for you. Like I've been there before, I'll be there for you. 'Cause you're there for me too. You're still in bed at 10 and work began at 8. You burn your breakfast so far, things are going great. Your mother warned you there'd be days like these, but she didn't tell you when the world has brought you down to your knees, that I'll be there for you. When the rain starts to pour, I'll be there for you. Like I've been there before, I'll be there for you. 'Cause you're there for me too. I'll be there for you. When the rain starts to pour, I'll be there for you. Like I've been there before, I'll be there for you. 'Cause you're there for me too. 'Cause you're there for me too.
Yeah, so that video just depicts the doorstep deliveries we did with food or other essential supplies, and some of the virtual services that we had, whether those were activities like the bingo activity you saw, or the physical therapy. You'd see our physical therapist rather, sorry, providing exercise, anything that we could do to, again, keep people connected during this time of shelter in place. I do want to mention just briefly here about the state budget crisis. Some of you may or may not know that last May, SteppingStone and other community-based adult services, CBAS or adult day healthcare agencies, were actually stunned by a proposal from Governor Newsom to revise the state budget in such a way as to end all support for adult day healthcare in California, meaning that every adult day healthcare center in California would close. And obviously this is driven by a large budget deficit created by the pandemic. But this forced us to take action and have vigorous advocacy to defeat the proposal. Next slide, Eric, please. And so we were working with the statewide California Association of Adult Day Services, or CADS, and coordinating our efforts with other CBAS agencies across California. I am a board member of the California Association of Adult Day Services as well. And we also partnered with other adult day healthcare centers in San Francisco, Self-Help for the Elderly, Bayview Senior Services, and L'Haim of Jewish and Family and Children's Services to advocate locally as well as statewide. And we were able to defeat the governor's proposal through the legislature that approved a new budget, continuing the support for our programs. And just a note of why advocacy is so important. I had a legislative aide of Senator Scott Wiener reach out to me after the budget was passed that insured services would continue. That said, thank you so much for educating us because we didn't realize what this meant to adult day healthcare and to the seniors that you serve if that proposal was approved. So that was really a large effort that quickly came together. We had about 5 weeks in order to respond to the governor's proposal and defeat that. But it was an effort that was well worth it, obviously. Next slide, Eric. And this is one of the pictures of a participant. And we use these pictures in our advocacy effort. And obviously this one says, save adult day healthcare. You know, if it wasn't the pandemic, if it wasn't for the pandemic, you would have seen people like this woman depicted in the picture marching on Sacramento. But we couldn't do that because everybody was sheltering in place. So, but what we were able to do was successful. Next slide, Eric. All right, enhancing care. One of the goals of our program through the grant was making sure that we can improve the services that we decided that we could provide during the pandemic. And so our doorstep visits, we increased our doorstep visits for at least 50% of our participants. And again, that was to deliver food or essential supplies, personal assessments where we could see people and providing physical therapy in person as well as visits by our nurses. Food delivery to, again, 50% of our participants. So we delivered food to their houses. We also had a food pickup program at our Golden Gate location at 350 Golden Gate. So we did doorstep deliveries from our Golden Gate, but we also had a twice a week food pickup for our participants during that time as well. Next slide, please. Newsletters and activity mailings to 100% of our participants. Again, another way that we kept our participants engaged was to provide them with activities. And so how do we do that? Well, we mailed a lot of activities to them prior to setting up virtual meetings and programs, which I'll talk about here in a little bit. But they enjoyed getting the newsletters from each of the centers that kept them up to date of what was happening in the pandemic and how we were responding to that, but also how other members of their group were doing as well. So it's one way to keep everybody connected. And then our delivery of essential supplies, again, to about 50% of the participants who needed essential supplies. Next slide, Eric. We were able to provide clinical assessments for 100% of our participants. And then bridging the digital divide, this was another advocacy effort that we were a part of. And actually, the coalition of agencies serving the elderly, and on the co-chair case, we had an advocacy effort to fund devices, internet connection, and technical support and education for seniors and adults with disabilities in San Francisco. And then SteppingStone actually became a recipient of some of that effort. So we were able to increase the virtual connection of our participants by 65% in this effort, which was huge for our participants, that we were able to connect them through Zoom or Skype. We provided devices for them. Through our fundraising efforts, we were able to get them internet connection, and this was a challenge for us. A lot of our time, once we were able to get them connected to the internet and get them the devices, was to educate them how to use a device and give them technical assistance. So that took quite a bit of effort and continues to take some effort to do, but it's well worth it, because at this point then, in support of our telehealth model, we were able to provide physical exercise classes, physical therapy classes, occupational therapy, support groups, and activity groups through Zoom with our participants, or they could have chat groups with one another through Skype. So this was a really good way for our participants to, again, not only stay connected with their healthcare providers, but also with their friends at the center. Eric, next slide, please. Eric, I wonder should we wait on questions, or if there's any questions that may have come up now? Maybe I could answer some questions if anybody has any, or if there's any in the chat.
We don't have any at the moment.
Okay, all right. Our vaccination efforts, once vaccinations became available in early 2021, getting our clients vaccinated became an urgent priority, of course. Again, all of our clients were isolated. Most were not tech savvy enough to make online appointments. And many of our clients were not well informed about the vaccination process. And there were quite a few barriers to our participants getting vaccinated. One was the education piece and helping people understand not only the need for vaccination, but some of the scientific data behind it, and that the vaccinations or the vaccines were safe. So there's a lot of education that we provided, and then we provided ways to help people get the vaccine and to assist them in scheduling appointments or mitigating any barriers such as transportation or any necessary assistance. And I think if any of you were getting vaccines, back in early February or March, when there was long lines and you had to stand in line for quite some time, even if we got participants there, it would always be helpful to have somebody with them, so they were just having somebody to support them and assist them as necessary. And so that was a really successful endeavor. Today, we have 95% of our participants vaccinated, and our goal is to make that 100%. So next slide. We, as an organization, value the cultural diversity in San Francisco and respect all different cultures that we work with. And the crimes, the Asian hate crimes that San Francisco experienced obviously were just deplorable. And we felt that we needed to respond. And 80% of our participants are Asian Pacific Islanders, and well over 60% of our staff are Asian Pacific Islanders. So we wanted to develop ways to keep our clients and our staff safe. So we offered classes on safe passage, and we did this virtually, and we did it through telehealth as well. We increased our doorstep deliveries, so if people were fearful of going out, if they needed food or they needed something where they were able to go out at one point, but now they were fearful, then we made the extra effort to do that for them. We offered self-defense classes for our staff, just as another means of protection. They were coming into the centers on a regular basis, so we didn't have a lot of people working remotely. Our centers were open so they could provide these services from the centers, and they could work as a clinical team. And so they all decided they wanted to come into the center. So we wanted to make sure that we could provide support to our staff when they were doing that. And sometimes that meant help with transportation, and also providing, as I said here, self-defense classes for our staff. And we also provided support groups for our staff as well during this time. We did provide mental health support, both to our clients and to our staff. And as I said, that we were assisting clients and our staff with transportation. And these efforts are continuing even today. All right, next slide, Eric. So as the pandemic at the time started seemingly to wane, and the state was reopening on June 15th, the California Department of Aging had wanted adult day healthcare to start opening up for InCenter Services. And and wanted to do so sometime after the beginning of July. We felt at SteppingStone that our participants had a great need to come back into the center for InCenter Services. But we want to provide it in a safe way. Throughout June, or the last couple of weeks of June, we complied with all of the CDC and OSHA and the San Francisco Department of Public Health and the California Department of Public Health requirements to open our centers for limited in-center services. We could only provide services for a limited number of people because of physical distancing requirements. So we started scheduling people in each of our centers for two reasons. It allowed our clinicians to personally examine participants, and it provided clients with an opportunity to socialize in person. And we felt that was really important, especially for so many of our participants that had faced isolation for the past really 16, 17 months. We're now completing assessments and reevaluations on our clients' health status and modifying their care plans as needed for all of them. And we've begun since July 6th, limited services in each of our centers. And now with the Delta variant, and it's, as we all know, it's highly transmissible variant. We are continuing to make sure that these services that we're providing in center is as safe as possible. But people are coming in that they really feel the need to come in. There are some participants that were scheduled to come in that have decided, with the Delta variant, they might want to hold off a little bit longer before coming into the center. But in doing so, we are providing now a hybrid model of care. Our temporary alternative services continues as is, and we are also providing in-center services for people coming into the centers. And that could range, typically right now, it's anywhere from 10 to 30 people at each center that are coming in to the centers. And typically we would have, at 3 of our centers, we would typically, pre-COVID, we had anywhere from 50 to 55 people at each center on a given day. And at one of our centers, we have a double shift. We had well over 100 at that center on a daily basis. So, but we're happy to see people in center, and obviously they're happy to see us, and we would hope as time allows, and we hopefully move past this forced surge in San Francisco, that we are able to continue to increase the number of people who come into our centers on a regular basis. Eric, next slide. And here are some pictures that illustrate some of the people that have come into our centers. You can see on the left, that is a equipment that allows for upper body movement and strength in the forefront. And in the back of that picture, somebody is working on an exercycle that improves leg and hip and core function. And next slide. As I mentioned, because some of the participants will only be receiving 1 or 2 of the days of care at the center, they will continue to receive remote services, again, our hybrid model, in-center and remote services, telehealth, food deliveries, online classes, doorstep evaluations will all continue. And, one of the challenges of having this dual system of care, it requires increased staffing and detailed management of each of the participants' health records as we move forward here. So we're doing this through a lot of coordination with the staff who meet regularly, daily at the center. The multidisciplinary team meets to discuss participants and highlights things that they need to pay attention to as we see. We do expect attendance to grow at each center over time, but again, that remains uncertain because of the pandemic. But what we know is certain is that there are hundreds of older adults and adults with disability who we have supported to maintain their health and remain in their homes, and using whatever we have in front of us and available to us, SteppingStone is going to continue to provide it. So that concludes my presentation, and I'm happy to answer any questions that anybody has.
Hey, thank you so much, Daniel, for that presentation. I see that there's a lot that SteppingStone has provided for the elderly and the community, from the telehealth to the providing services, delivery, classes. That's all amazing. Yeah, if you have any questions about this project, feel free to leave them in the chat box on Zoom, or if you're on YouTube, you can also leave it in the live chat window there. If you can't type, you can also raise your hand on Zoom if you want to ask directly. But we do have questions of our own as well. So for this Q&A session, the first question we have for you, Daniel, is for the CCXCA grant project, how can people qualify to be a recipient for your services?
Yeah, so most of our participants qualify if they're eligible for Medi-Cal. So all of our participants currently are Medi-Cal beneficiaries, and they would qualify for adult day health if they, there's two things. You have to be over 18 years old and have one or more chronic or post-acute medical, cognitive, or mental health conditions. And a physician or a nurse practitioner or other healthcare provider who within the scope of their practice is requesting adult day healthcare services. And also a person who has functional impairments and two or more daily living activities requiring assistance would qualify as well. But this is, if one qualifies for Medi-Cal and meets those requirements, it is entirely free for the beneficiary.
Great. Next question we have is, besides the CCXCA grant project, what kind of services do you offer, and if there are any free services for everyone in the community?
Yeah, unfortunately, they're not free services for everyone in the community. We provide healthcare in a day program. So we provide skilled nursing services, physical therapy, occupational therapy, speech therapy, activities, social work activities, referrals, advocacy, throughout the day. Typically, again, pre-COVID, it's a 4-hour program, 4-hour daily program. We also provide transportation to and from the center, again, free of charge for the eligible beneficiary. And I think the other piece of that is we provide socialization for our participants during those 4 hours. One of the ways we do that is we provide a hot, nutritious lunch for everybody in a group setting. Again, that was pre-COVID. As we open up our centers now, we open up for, again, limited time, limited number of people, and we provide snacks at this point in time, just because we're not allowed to provide congregate meals yet under our licensing guidelines.
Snacks are always great, though. So can you tell us what kind of services you provide for one-on-one consultation or for group settings?
Yeah. So a couple other ancillary services. We provide mental health services and substance abuse services, both individual and group. And I mentioned speech therapy as well. And as I mentioned throughout my presentation, we provide socialization groups, both in center now and virtually. But we see a real need to provide mental health services for individuals and groups, and also substance abuse as well.
So the next question is, well, it might be a bit obvious from the project's title, but who are your ideal clients for this project and the other services?
Well, yeah, I mean, obviously our ideal clients are older adults and adults with disabilities. That's who we serve. And our goal there is to help people stay in their homes and thrive in their communities and not be forced into skilled nursing facilities or hospitals. If we can keep them healthy enough to stay at home, that is entirely the goal of our program. So I think the other ideal client is somebody who obviously is eligible for Medi-Cal, and we get funded through managed care Medi-Cal. So if a client has San Francisco Health Plan as insurance or Anthem Blue Cross, we also serve veterans through the VA. Those are our current participants. Ideally, we just want to make sure that if someone who meets the eligibility criteria needs adult day health care and it would help them stay at home, we can provide the services to help them stay healthy enough to stay at home. Those are our ideal clients. I think what we're also going to embark on is we work quite a bit with marginalized populations, people obviously who are impoverished, or people that live alone, people that live in single room occupancy hotels, the formerly unhoused people that may be housed. We reach out to those people to see if they have a need as well, because a lot of our population had not known about adult day health care unless we provided outreach. So we do provide outreach to marginalized populations as well, to see if there's a need there for them for adult day health care.
Great. Okay. So you mentioned before about the challenges that happened due to the pandemic, and I was just wondering if there were any other challenges you experienced so far implementing this project, either for SteppingStone itself or for the community that you serve.
Yeah, I think, I don't say this lightly, I think everything that we try to do during the pandemic is a challenge, quite frankly. Even as we speak now, we had made plans, as I mentioned, for InCenter Services, and with the guidance changing seemingly every other week, very difficult to continue to make plans. But we are steadfast right now in our ability and our passion to continue to provide the InCenter services we have with a limited number of clients, continue to provide our task services, which means that we're going to continue our in-home services, or doorstep deliveries as well. The challenges there are, when we provided congregate meals for all of our participants pre-pandemic, we were reimbursed for those meals through the California Department of Education. We're not reimbursed at this point for any of the food that we buy or the delivery of that food for our participants now. So that's a bit of a challenge. We're meeting that challenge, but that'll be a continuing challenge as the pandemic continues. The other challenge is just getting more devices in people's hands. Like I said, 65% of our participants are able to get online for our activities now, but we know that in San Francisco, the aging population continues to grow, and there's a greater need for internet connection. There's a greater need for devices, and there's a tremendous need for tech support and education, and we're going to continue in that effort. Again, that is funding is always a challenge, and we've embarked again with other agencies in San Francisco to advocate for more funding to bridge the digital divide. We've had some success with that, but we know that is a long-term advocacy effort. So we're in it for the long term there. So enhancing care in the way of providing doorstep deliveries, enhancing care to provide virtual connection for seniors continues to be a challenge, but those are challenges that we can meet.
Well, hopefully things will work out very well very soon for you. So on the flip side of that, can you share any successful stories so far for implementing this project?
Yeah, I think the biggest success that we've had is keeping everybody connected. We literally have connected with 100% of our participants and kept them connected. We've increased our utilization rate dramatically with task services, and I think that's a huge success to make sure that people stayed connected with us. They stayed connected to their healthcare providers, whether that was their nurse or their occupational therapist or their physical therapist. I think being able to provide the healthcare that we provided to everyone in the last 16 or 17 months through the pandemic has been a great success. We lost some participants. Some have passed away, and we gained some participants. So there's some sad stories and there's some good stories with that. But for the most part, we really help people stay in their homes and maintain their health up to this point. And to me, I think that's our best success in all of this.
Yeah, that sounds really amazing. I wish you more success in the future as well.
Great.
So this will be the last question for you. What is the best way to get in touch with SteppingStone?
Well, I think the best way is to view our website, which is www.steppingstonehealth.org. There's a lot of information about our services and our telehealth and now our hybrid services on that. And it also gives contact information for each of our centers. with a contact person and a phone number. So if there's a referral form on our website as well. So if there's a person who needs adult day healthcare who is working with a primary care provider or a social worker, they can go on our website, look at the referral form, and apply for either apply or make a referral for adult day healthcare that way. Again, you can call, those numbers are posted on our website with the names of our program directors at each site. You can call them as well, and they would direct anybody how to either make a referral to adult day healthcare, or if they needed some other type of care, we are well connected with other partners in San Francisco who provide different kinds of services, and we can make referrals for services other than adult day healthcare as well.
Hey, that's great. We'll make sure to include the website and number in our description of the video once this is finished.
Yeah.
So yeah, thank you very much. And that will conclude today's CCHCA grant program for Stepping Stone. As a reminder, we have more presentations for the program coming up. You can access the schedule located on our website at aamgdoctors.com. If you click on the English site button there, and then if you'd like to learn more about the Community Grants Program, you can also find it on our page here on the Community tab. And we also have a schedule that you can access located on our site here, the online health workshop schedule, to see what upcoming talks what we have. And like I said, yeah, the Community Grants Program, if you want to learn more, it is in the Community tab up here. And you can also access it just by going to amgdoctors.com/community-grants-program. So I've been your host, Eric from AAMG. We post the latest updates on our news page as well as on our social media platforms like Facebook, Instagram, Twitter. You can watch this presentation as well as hundreds of our other videos on many different health topics right on our YouTube channel at AMG Doctors. So you can see the QR code there. Thank you everyone who joined us today for this event, and a very special thanks to Daniel from SteppingStone for coming on and sharing the presentation with us. So that will be the end of the program. And until then, stay safe and healthy, everyone. Bye-bye.
Thank you, Eric.
Thank you.